So this presentation will go over a new treatment protocol. First off, I would like to introduce myself to those who have not formally met me. I am Keela Heisel. I am a wife and mother of 3. I have been a dental hygienist for 15 years, and I am currently furthering my education in healthcare management. I am also an author and co-founder of Tell Her She's Beautiful. I love to travel, spend time with loved ones, read, write, and help those in need. We will discuss the out-of-pocket cost of dentistry. There will be a leadership model presented to help change the effects of out-of-pocket cost of dentistry. Strategies for model adoption and stakeholder buy-in. So strategies to implement the model and to get the stakeholders to buy in. And then we will also discuss an evaluation plan. We will discuss the out-of-pocket cost of dentistry. The cost of dentistry, I'm referring to the out-of-pocket cost, and that is after insurance pays for those who are insured, usually through their employer. All insurances are different. I will give examples of average insurance coverage. Preventative is usually covered 100% by insurance. This includes yearly x-rays, prophy, which is a cleaning, dental exam, assessments, fluoride treatment, and sealants for children. Major restorations include fillings. This is usually covered anywhere between 50 to 80% by insurance. Patient portions are the remaining 20 to 50%. Major restorations includes crowns, root canals, bridges, partials, dentures, usually covered by insurance 50%, leaving a 50% payment portion for the patient. Specialty offices for things like extractions, root canals, ortho, braces. Specialty offices cost more than a general dental office. So a root canal here would cost more, a root canal here would cost less than the endodontic office. When we send a patient to a specialty office, we wait until the treatment is complete there before doing any other treatment because the referred treatment may max out insurance. Dental insurance, the last slide, we went over an overview of dental insurance and patient portion. This slide will explain a little more about out-of-pocket costs. Yearly max. Dental insurances have a yearly max of what they cover, usually anywhere between $1,000 to $1,000 to $3,000, with the average being more around 1,000. 2 crowns can easily max a patient out for the year. The patient has to wait until the next fiscal year for more coverage, including preventative coverage. Deductibles. Some insurance companies have deductibles a patient has to pay before any procedure is covered. This includes preventative procedures. The deductible is usually at $50, sometimes more. Approvals. Sometimes insurance do not even approve what needs to be done, leaving the patient with even more out-of-pocket costs. All these reasons are more reasons patients have a large cost for the treatment that need to be done and why treatment is delayed or avoided. So, patients delay treatment because of cost, but that actually increases the cost of treatment because now they need more treatment. The dynamic culture leadership model is next. The dynamic culture leadership model compares leadership and management, and it also compares science and art within leadership. So leadership is a longer time. Management is a shorter time. Leadership starts with a vision and then a mission. Management is mission oriented. Leadership is more of, are we doing the right things? And management is, are we doing are we doing things correctly and consistently? Science is more technical skills. Art is relationship oriented. Science is decision based on analysts. Art is decisions based on perceptions of people. This model wants the team to be able to use their knowledge, skills, and abilities to perform. And elements to do this. The first one is communication improvement, is the leadership and management team engagement and predetermined model training, rewarding and assimilating of the communication environment into the organization and the means that best contributes to the effective organizational culture. Strategic planning is the structured, inclusive process of planning to determine a mission, vision, strategies, goals, objectives, and actions that are consistent with organizational values and that meet the external environment's expectations of the organization. Decision making alignment involves aligning decisions with a strategic and operational plan while understanding reality-based decision making. Employee enhancement is the assessment of employee knowledge, skills, abilities, experience, and trustworthiness, and the practice of increasing or reducing responsibilities. Knowledge management and organizational learning involve capturing what the organization knows and what it has learned so that improvements to effectiveness, efficiency can be achieved. Evaluating, reflecting, and retooling is the leadership and management team's honest assessment of this model and ways to improve the cycle in the next repetition. Now that we have a model, we need to figure out how to apply it and how to get the stakeholder to buy in. So, strategies for model adoption, education, make sure everyone understands what's going on. Training, make sure those involved are competent to perform. Implementation, take action. Evaluation, make sure the changes are working. Strategies for stakeholder buy-in. Education, present the case to the stakeholders so they understand why change is needed. Involvement, get their input on how to make the changes and the pros and cons. Negotiate and compromise to reach the larger goal, the bigger picture. Follow up to make sure the plan is working and everyone is satisfied. Evaluation plan for determining the model's efficiency and effectiveness is what we will cover in the next slide. Evaluation plan for determining the model's efficiency and effectiveness. Surveys for employees and patients before and after changes to evaluate differences. So we can give surveys to the employees to see how they feel about going through procedures before the changes and after. And then we can give surveys to the patients before we make the changes and after to see if they feel any effect on getting the treatment done. If they feel like they're more able to get treatment done after the changes than before. If dentistry seems more cost effective, which is going to be the same cost, but we're going to be working more with how the patient can make payments or can pay per year and schedule accordingly how they can pay per visit. Comparison of completed treatment versus non-completed treatment. So we can look at the completed treatment now and compare it to completed treatment after we change the protocol. So we can see how much treatment we have left untreated before and after, cause and effect of the changes. Production. We can see how the production changes. Did the production increase? Did it stay the same? Did it decrease? Our goal is to get it to increase. No, we're not doing it for production. That's not our main goal. Our main goal is to get the patients the treatment they need. But of course, healthcare is a business. We have to get paid. We have to keep the lights on here. We have to get the equipment we need. So we need to make production. Schedule changes. See how the schedule is now compared to after the changes. Is it fuller? Is it more productive? So we will compare before and after to see how the changes worked, how the model we are using worked. With a strategy to make sure the patients fully understand the treatment plan and urgency. Also identify what patients can afford out of pocket and insurance coverage per year. A thorough treatment plan can be made with options of payment for the patient to make sure treatment is done. That's our goal. Make sure treatment is done. So we're going to work with the patient. The patient's going to work with us. But the goal is to get the patient the treatment that they need. Disease in the mouth contributes to disease in the body. And we need to make sure the patient understands that and make sure the patient's willing to work with the schedule or able to work with the schedule being made. And that's the goal. Here are my references. Any questions? Thank you all so much.